Good afternoon, everyone. My name is Angela DeRolf, and I am your Perry County Health Commissioner working at the Perry County Health Department. And I wanted to give you a quick update on our COVID-19 response. So as of today, I want to be very clear, Perry County still has 0 confirmed cases of COVID-19. However, I wanted to share with you some of the data as of 2 o'clock today. So currently, Ohio has 169 cases of COVID-19. Again, Perry County has 0. Age ranges from 1 year of age to 91 years of age, 69 females and 100 males, 39 hospitalizations, and I'm sad to report that Ohio has seen its first death. Confirmed cases per county: Ashland County has had 1, Ashtabula 1, Belmont 2, Butler 12, Clark 1, Coshocton 2, Cuyahoga 69, Darke 1, Delaware 2, Franklin 14, Geauga 1, Hamilton 7, Huron 1, Lake 3, Lorain 10, Lucas 2, Mahoning 7, Marion 1, Medina 6, Miami 1, Montgomery 1, Richland 1, Stark 6, Summit 10, Trumbull 3, Tuscarawas 1, Union 1, and Warren 2. As you can see, our cases continue to increase across the state. We also learned some information earlier that the virus that causes coronavirus disease, the COVID-19, is stable for several hours to days in aerosols on surfaces. And this is according to a study from the National Institute of Health, CDC, UCLA, and Princeton universities, and it was published in the New England Journal of Medicine. So what we know about COVID-19 is that it is detectable in aerosols for up to 3 hours, up to 4 hours on copper, up to 24 hours on cardboard, and up to 2 to 3 days on plastic and stainless steel. The findings in this research do affirm the guidance from public health professionals that we need to use precautions similar to those for influenza and other viruses. So what does that mean for you? We are asking that you take this very serious. If you are sick, stay at home. Avoid contact with people that are sick. Make sure you're taking care of yourself. Get adequate sleep and eat well-balanced meals. I can't stress this enough. You need to wash your hands with hot soapy water and wash them often, and make sure you're doing it 20 seconds or longer. If you do not have soap or water, sanitizer with 60% alcohol or greater is what you can use. Make sure that you cover your mouth with a tissue when you cough or sneeze. Throw that tissue away and wash your hands again. Avoid touching your eyes, nose, and mouth. I know this can be hard, but we really need you to do this. We need you to clean and disinfect high-touch surfaces. Think of your doorknobs, your light switches, your TV remote, your phones. Make sure you're cleaning all of those areas. If you are sick, call before visiting a doctor. And make sure you're practicing good hygiene habits. And above all, if you can stay home, stay home. Help stop the spread. Please listen to what the governor is saying and the director of the Ohio Department of Health and follow their orders. Some of the things that you can do at work, some of the best practices that we have seen, is if you're an employer, have your employees take their temperature before coming into the office. If their temperature is 100.4 or greater, they need to stay home. You can also have them take their temperature throughout the day if your business has thermometers available. And again, at any point in time, if the temperature is 100.4 or greater, that employee needs to go home. Make sure as an employer you are cleaning high-touch surfaces. Think about railings, think about doorknobs, counter spaces. You may want to think about removing chairs out in certain areas so that way people don't sit together and congregate together. You want to think about staggering lunch breaks or other breaks throughout the day. We want to make sure we're keeping in mind social distancing, keeping employees 6 feet apart from each other to help stop the spread or slow the spread. Again, I already touched the social distancing from one another. If you're a business, try to make shifts. That way that people don't congregate together. Try to spread people out. And above all, make sure you encourage and give your staff time to do frequent hand washing breaks. Also, make sure if you have staff that they're not sharing telephones, pencils, paper, other equipment without constantly wiping them off. Make sure they have their own pieces of equipment within the workspace. So again, help us with rumor control. You need to make sure you're using the most credible information. Visit coronavirus.ohio.gov. That is the state's website that has been created, and they're constantly updating that with new messages. If you have general COVID-19 questions, call 1-833-427-5634. That is the state's hotline that they have put together. It is manned by licensed nurses and infectious disease specialists that can answer your questions, and they get updated scripts each day, so they have the most up-to-date information. And then I can't stress enough, follow our Facebook page, the Perry County Health Department Facebook page. We are constantly updating it to make sure you have the most updated information as well. In closing, I just want to remind you, seek out credible information. Also, be mindful of how others are feeling. So don't be afraid to pick up the phone, call your neighbor, call your friend. Talk to one another, check up on each other. Just because we're social distancing and keeping 6 feet away from each other does not mean that you can't pick up the phone and still talk to one another. And then if you have any thoughts or suggestions on how we can try to work together to keep each other safe, please contact us at the health department. We're always willing to look at new ideas and need to know what your resource needs are. Thank you.